we can use that information to anticipate where disparities might arise and where we need to build partnerships moving forward. So it's against this backdrop and this story that beginning last February, my colleagues and I developed the COVID-19 Health Equity Dashboard. The goal of this dashboard was to put COVID-19 in context. So to place the burden of COVID-19 cases and deaths in its social determinants context. We were eager to allow users to do quick and easy benchmarking and tracking of their counties relative to the state, relative to the nation. And part of the goal was to make these data public so that people can better protect themselves and decision makers can better act. And so with that, I'm going to actually begin sharing my screen. And let me just see. I'm going to take you to the dashboard. Is the dashboard visible? If someone can.
It is.
Confirm. Great. Perfect. So this is the landing page of the dashboard. And again, as indicated by the title, the Health Equity Dashboard, we really wanted to shine a light on the health disparities that were emerging from the earliest days of the pandemic. You can see on the right-hand side a national summary where we are with respect to daily cases, daily deaths. And also on the landing page, you can see where we are with respect to the racial and ethnic disparities in COVID-19 deaths. And so this is where I go to see that, okay, today, as of today, there are 80 deaths per 100,000 residents who are African-American in the United States, whereas there are 62 deaths per 100,000 residents who are white. You can also get this information by state. And so you can toggle over. So if I look at the state of Georgia, I see that actually there's not a substantial cumulative race ethnic disparity in COVID-19 deaths at this time. This picture was a little different earlier last year, and it's a little different now. However, I can quickly compare to other states. So I was born in Michigan, so I'm always doing that comparison. And you see that deaths in the African-American community are nearly twice as high, a little bit less than twice as high than deaths in the white community in Michigan. If we look at Texas, the disproportionate mortality in Hispanic Americans becomes apparent, and so on and so forth. To give you a demo, I'm just going to click into the state of Georgia. And forgive me, my internet is between the Zoom with the camera and the rest of it. My internet is not always great. So let's just see. Okay, so once you click into a state, you'll get a summary of cases and deaths and hospitalizations, as well as the percent positive. We're tracking all of these measures to understand different components of the epidemic. So where are we going? Are we doing enough testing? What is the healthcare system strain looking like? And again, you can find the deaths by race and ethnicity. Scrolling downwards, you can find an interactive map that will give you county data. And what's one of the features of this map is, and of these data and these charts, is that you're able to quickly compare your county to the state and nation, and again, hover over whichever county is of interest to you. So if I look at, say, Fulton County, which is the major county in metropolitan Atlanta, we see that COVID-19 cases were especially high in the first in the first wave, what we call the first wave, and the second wave, and they were higher than the national average. But then they've tracked with the state average pretty much throughout. If I instead click on a county like Whitfield County, this one stands out. If I can stay there, Whitfield County sticks out because you see that COVID-19 cases have been higher than the state and national average throughout the pandemic, through each of the waves. So this is the kind of information you can get in terms of the COVID-19 epidemiology. And right below, you'll also see an interactive set of charts on the population characteristics of each county. So again, you can understand whether or not part of a county's burden has to do with its social determinants, such as the overall community vulnerability index. There's also additional information that you can get by clicking into a county. You can get a county report. In response to the vaccination rollout and in our effort to also track what is happening there, we have launched a COVID-19 vaccination tracker that at the landing page will give you the summary for the United States. So the total doses distributed and the numbers who've received one dose versus a second dose. You can also see the percent of the population that's partially vaccinated and fully vaccinated at any given time. This information is daily. And again, a key feature of everything on this tool is to make it interactive and to allow for comparison. So once you scroll over a state on this map, you have to select a state for the data to populate. And on the right-hand side, I've clicked on Georgia, so I can see the vaccination status in Georgia relative to the United States. So I can see that the percentage that has received the first dose is a little bit lower than the national average here. And scrolling down further below, it'll give me a summary of where Georgia stands with respect to the cases, the deaths, and of course, the racial inequity in death rates. Going down below, the other thing that's a little different about this vaccination page versus the other features of this dashboard, and I won't go through them all here, but I invite you to have a look when you have a chance, is the frequently asked questions about COVID-19. So this is extremely important because what we've heard so far from the public is that the vaccine hesitancy is also linked to the lack of information. So a lot of surveys have told us that if people are better equipped to talk about and understand the side effects, they feel more confident in taking the vaccine. So I'm going to conclude the demonstration right here, and I'll leave it to Susan to open it up for questions. Thank you.
Okay, great. We're going to go ahead and turn it over to questions. We will take the first question here. Do you believe the CVS and Walgreens vaccine rollout will help ease access and racial disparity problems encountered during the initial vaccine rollout?
That's a great question. So I think it might, we hope that it will help ease some of the access issues. However, there is a reason to be concerned that it won't fully solve the problem. So if you look at where these pharmacies are located, they tend not to be located in the highest risk areas. This is going to vary from state to state, county to county. And that's, again, why we need to have very localized information. So the advocacy that we are doing with the Health Equity Dashboard and with our partners is to do a better job of anticipating where are we going to fall short with respect to those pharmacies. Furthermore, I'll just say that even within those pharmacies, not all Walgreens, not all CVSs will be distributing the vaccine. That's my understanding. And so I'm concerned that there are going to also be disparities with respect to exactly which of those pharmacies and which locations will be distributing the vaccines.
Is there data on the dashboard that shows vaccinations by race for any states?
So we haven't incorporated that information just yet because it is not being compiled at the state level centrally. And what we have a team in place that is pulling those data where possible from the state dashboards. And we are planning to bring that into the same framework that that allows for comparisons across states. So that's something in progress. We don't have that ready for you yet.
Okay, great. Next question. Can you talk about what conversations you've had with state and local health departments to better direct doses to communities that might have higher proportions of vulnerable people?
Sure. So the vaccination piece is something that it's of course been on our mind for some time, but I've not been as directly involved with those discussions. From the discussions that I have had with my colleagues at the Georgia Department of Public Health, I know that they're very interested in closing the equity gaps. I know that they are internally tracking those demographics. I know that there is an interest in potentially, for example, engaging mobile vaccination clinics and that sort of thing. I can't give you a sense of when that's going to happen and where that's going to happen. But I do know that there is some interest and discussion around those areas. I'm also hopeful that the vaccination dashboard that is to be imminently released will have some of that information for us.
Great, thank you. How does a lack of data available and demographic data from states hamper efforts to make vaccine distribution more equitable?
Well, right now we're just tracking the overall number. So it's really because supply exceeds the current demand. It's, I shouldn't say it's easy, but it is easier to keep giving out those vaccines to on a first come, first serve basis. And so without tracking in each state and each county who is eligible to get the vaccine demographically speaking. We use the demographics because they track with a lot of the other social determinants of health. We could be thinking about other kinds of factors too that we would want to ensure equity over. But if we have that information, then we can understand whether or not the vaccines are going disproportionately to one community to another. And unfortunately, the information we have so far suggests that the vaccines are disproportionately going to more advantaged communities, especially white Americans as compared to Americans of color.
Great, thank you. What is the recommendation of policymakers for counties which have neither CVS nor Walgreens stores? How to better expand access there?
Yeah, absolutely. So I think that it's really important to think about the mobile vaccination camp sort of idea and explore what models exist where it's been done successfully, potentially even borrowing from global models where this sort of thing has been done at low cost and very efficiently, and it's been done for a variety of other vaccines. So I think that I think it's going to be about taking the vaccines out to people, and we've seen with the testing sites that this is feasible, it's actionable. But I think part of it is we need to have partnerships, especially trusted partnerships in the communities to deliver on that, because I think just showing up is not going to be enough. We need to have local partners, community partners that have credibility to engage with the health department on these sorts of activities.
Great, thank you. Where are you seeing these racial disparities the most in Georgia currently?
So, in terms of the racial disparities in deaths and that sort of thing, which is what we have some data on, we actually see a lot of them occur at the fringe. So both in the metro area and also in the very rural areas. So far, that's what the data have suggested. What's interesting about this and scary also about COVID is that the epidemic is so fast moving. So what is true today might not be true tomorrow. And that's perhaps what motivated that question. We know that the epidemic is getting more and more rural. And so it remains to be seen, I guess, how far that will go and what to expect there.
Right. And where is the data coming from for this tracker? State and local health officials, DPH?
Yeah, so the data ultimately all come from state and local health departments, and then they're aggregated. So we use different data in different places. So we use a combination of the CDC data that they provide and also the New York Times database. Also, the social determinants of health come from multiple federal data sources that are well established.
Great. Are you optimistic that the access to information will improve soon? Also, do you see a future with better contact tracing?
Great questions. I am optimistic. That might be just a personality attribute, but I also think that we have to be optimistic in order to tackle this one. I'm optimistic because when it comes to especially vaccinations, when we think about at the federal level, there's a renewed interest in science and data transparency. I think at the local level, there's always been a persistent interest in supporting the health of the populations. So I think that there's a convergence now, and it's a matter of getting the data out there. I believe that people want to do right. These agencies want to do right. It's a matter of getting everything together in a way that can consistently and transparently, I think, communicate the information. It seems there are a lot of operational and logistical concerns, but the public demand and from folks like you and also researchers, other public health practitioners from outside of these agencies, I think is strong enough that the political will internally and externally is looking favorable for more transparent data communications.
Great. What role do federally guaranteed clinics play in rural vaccine access?
Yeah, I think they're going to play a major role. And in fact, so we at Emory have partnered with federally health qualified clinics across the state in 11 counties for COVID-19 testing. And we are now considering ways in which we can engage those same clinics to support vaccination. So I think they are, again, trusted partners in the community. They know what is happening. They know why people are coming in and why people are not coming in. And so I think it's really important to listen to those experiences and support them in responding to the pandemic. And that's what we're trying to do with the dashboard. For example, with the FAQs, taking the kinds of insights we're getting from our community advisory board through the federally qualified health clinics and putting that information into an accessible, transparent way on, for example, vaccine side effects and that sort of thing.
Great. Well, Dr. Patel, thank you very much. We're going to go ahead and wrap there. Want to turn it over to you for any final comments before we conclude?
Yeah, I think that the key here is going to be that transparent data communication and health information communication for an effective response. I think that this is going to help us stay coordinated in a nonpartisan way. And again, if we've learned anything in the past year, I think we've learned that we need to have a coordinated, nonpartisan response to this pandemic. And we hope that the dashboard as an interactive tool can really facilitate that transparent communication and connect the communities that we want to serve with the information they deserve.
Great, thank you very much. That concludes this morning's briefing. As a reminder, we will be distributing the recording within 10 minutes following this briefing. If you have any follow-up questions or require any additional information, please reach out to Catherine Morrow and she will get you the information that you need. Thank you to everybody for joining us today. Take care.